What is the most desired nose shape? This is sort of an age-old question. What do people want from their noses? I can tell you what, as a general rule, patients bring me. I've done a lot of nose jobs in my life, and patients bring me pictures of noses that they like. And it's very interesting. They bring tiny and stylized noses. Noses that don't stick out much from their face, that are a little turned up, and that have a little break in the profile. What makes a good side nose profile? As a general rule, we want the upper part of the profile to be straight with a little bit of what we call a break here, where there's a slight concavity here and a slightly elevated nasal tip. Now realize you're looking at my nose, and I'm a 6'2" guy, and some of my patients are 5'1" females. So it's a stylized nose in someone who's very tall may be unattractive, whereas somebody short that has a smaller face wants a more stylized and smaller nose. What is the perfect nose size? So there isn't a perfect nose size. Realize some people have stronger noses. We might talk of them as like Germanic or Roman noses. Some of those have high takeoff points on the nasal profile. A taller guy should theoretically have a little stronger nose. And they may want their profile to be straight without any turn up. But a shorter woman may want a narrower tip with the tip slightly turned up and a little more of what we call a break. And the break, I don't mean the nose is broken, but a break between the bridge and the tip, where there's a little bit of a concavity in here. We call that the supra tip, above the tip break. But there isn't anything that's perfect. The nose shape can be variable, and different people can have, they're more of a candidate to have a bigger or smaller nose. What I like to do with my patients are see what they like, and in general, I like noses that look relatively natural. What do I mean by natural? That doesn't mean I don't change them. I change them a lot. People often say my results are subtle. I don't think they're subtle at all, but I think the after looks like someone born with an attractive or beautiful nose, not somebody that has a surgical nose. I think surgical noses are pinched more, tip elevated more, the tip is, and maybe the bridge is narrower. And we're always trying to create harmony with the smallness that we create and not make it look operated upon. And that's sort of the trick. So I try and see what my patients want. I try to listen to them, and then I try to accomplish what they want. Now, one last thing that I'm going to say that's very important, and everybody that's out there listening to this should know. A lot of times, somebody will come to me, either they've not had a nose job or they've had one and they want the nose smaller. I want it, doctor, I want it smaller. I went to Dr. X and it's not, my nose isn't small enough, and I can't breathe. Realize that as a general rule, small noses don't breathe as well. There's less room underneath the tent for air to get in. So the smaller that you make a nose, the less well it breathes. So I always make it a point to try and straighten the septum and create enough width to the middle third of the nose and enough support here that there's no collapse that alters or obstructs the nasal breathing. This is an operation that we want to maximize function, breathing, and maximize aesthetics or appearance. We want to do both of those. Can rhinoplasty fix my nose shape? To me, there is no better operation on the face or the body. If you have a well-done nose job, it makes everyone prettier or more handsome. And I often tell patients that are looking and trying to find out what I do, look at my patients, the afters all look prettier or more handsome. That's what my goal is. It's not a specific shape or a specific size. It's to optimize their face. That's what I try and do. If you want to get a consultation with me and understand my philosophy and style and apply it to your face, I'd be glad to see you. Come in for a consultation, do a virtual consultation, call my office, email me. I would love to see you. This is what I have a passion for doing. I look forward to seeing you in my office. Thanks.